Medications for opioid use disorders in correctional settings. Shifting the paradigm, creating a balanced correctional and rehabilitative approach. The Opioid Response Network is funded by SAMHSA to provide resources and technical assistance needed locally to address the opioid crisis. This video is part of a series to provide guidance on the implementation of medications for opioid use disorder in correctional facilities. Leading corrections and behavioral health experts present information on topics such as the use of medication, models of delivery, diversion, and linkages to care and community support. Kathryn Cates-Wessel welcomes state officials and other dignitaries.
Welcome, everyone. I'm going to tell you something personal about me you're going to notice when you hear me talk. I have a twang. I'm Southern. I was born in the South, but I live in New England. I talk fast. I get very passionate about what I do. So if you notice to kind of push me, pull you, I'm Southern, but I'm also a Yankee, as my family would say. So I'll try my best to make it easy for you to understand. I'm with the American Academy of Addiction Psychiatry. As Lori said, we are housed, our national office is here in Providence. And I was at Brown University for 19 years in the Center for Alcohol and Addiction Studies. I've been in the field for over 30 years, and I have to say it's so warm and welcoming to know that law and medicine are coming together, because this is a public health and a public safety priority, and we have to work together. And so for me, it really is about taking a village. We need to respect and understand where everybody's coming from, but acknowledge that there are health aspects of this, but there's also the law that we have to take care of. So I think this really helps build on that relationship, and you're going to see more and more from the Opioid Response Network about that. So what is the Opioid Response Network? Prior to this conference, had any of you heard of ORN, or Opioid Response Network? How many of you had heard of it? Awesome. What happened when SAMHSA put this together, it started out to be only for the single state agencies, and quickly, 2 days before we got the money, we got a call and said, guess what? This is going to be for the whole country, not just for single state agencies. And we're like, what? And it truly is. So what happened was we were given the opportunity to bring in a coalition together of major players in medicine, healthcare, and beyond to develop a network for technical assistance. How can we provide training and education? Now, let me just say this to begin with. It's all free. Your tax dollars pay for this, and you're going to go, what? This is free? And it's meant to be locally driven. So you have a need in your community, then you come to us, and we can provide the training and education with the expert or the experienced person to come in. So we were put to the task of, within the first 60 days, to do a needs assessment for the entire country. In the first 90 days, put together a technical assistance program with prevention, treatment, and recovery. So what is our goal? It's to provide training and technical assistance through local experts or individuals, not always experts, but individuals that have experience in touching on prevention, treatment, and recovery, and making sure that we address local needs. This is not for us to come in and tell you what you're doing wrong or not doing. This is for us to facilitate and support what you need and what you've defined as what's important. So what are our goals? We want to increase the number of prescribers and educate allied health professionals to support the prescribers, increase availabilities of peers, and to support the people at risk of seeking recovery, and also to reduce barriers. We all know that stigma is a huge issue, along with other barriers that for clinicians, peer recovery providers, and others to be able to provide the necessary care that's needed. So who's involved with this? As I said, the American Academy of Addiction Psychiatry that I work with is the primary awardee, but it's not just us. It takes a village, and we knew that through our work over the years. The ATTC, Addiction Technology Transfer Center, had been a partner of ours for many years. We didn't want to recreate the wheel. We didn't want to waste resources, and we didn't want to replicate or compete with anything else that's already going on. So we took what we knew from working in the past in training and educating health professionals, joined with the Addiction Technology Transfer Center and other partners through medicine and beyond to build a large coalition that makes up this network. So give you a couple examples, and I'm just going to one or two, you can always go onto our website, Opioid Response Network, and get examples of what types of questions or requests that have come in. A couple of them, Oklahoma had a county jail in Tulsa that wanted some technical assistance on evidence-based practices. Another one was the state of California had us train over 600 of their clinicians on motivational interviewing. So we went over and we come in and provide you what the technical assistance or training and education that you need, providing hopefully with local resources. We've vetted prevention, treatment, and recovery people in every state and territory in the entire country. And when you don't have those resources locally, it's our responsibility and our expense to bring those people to you. So yes, it's free, it's for you. So if you have a training or an opportunity where you need someone to come in that have expertise that you don't have, all you do is go to Opioid Response Network and put in a request. So how do you submit a request? Literally, you go to Opioid Response Network, and I want to submit a request. Within 24 hours, 24 hours, you will get a response back from a technology transfer specialist in your state, designated to work with you, and they will respond back, and then within 3 days, you will have arranged usually a call on a phone to talk about learning more about what you need. Because really, a lot of times when people put in a request, they don't quite know exactly what they need. They have an idea. And so once you talk to the technology specialist, they'll dig a little deeper, they'll ask questions, they'll really get a sense of what your needs are. And then they go back to their pool of prevention, treatment, and recovery consultants, and they say, it's like a temporary agency. Who do I need to fill this need? And then they network and introduce those people to the requester. And then we follow up and track that to make sure we're not duplicating efforts or wasting resources. So what have we done so far? This has been a pilot project with SAMHSA. Within the first round of this, a minimum of 2.8 million people have been impacted by this. We've provided over 5,700 training activities. For every request that comes in, an average of 400 related activities come out as a result of that. So far we feel made a really good impact, and there's lots more opportunity. So hopefully through this effort, this is just one example. This was a Rhode Island technical assistance request. That's how it started. They had a need. They had lots of people contacting them because of the amazing work they've done here in our home state of Rhode Island. And they wanted to share that, but it became overwhelming. And so we said, why don't we support your efforts in getting the word out, sharing information, promoting these evidence-based practices. And so this is what evolved out of it. So it gives you an idea of what happens through ORN when we come together and help support one another. Thank you.
Technical assistance is available to support the evidence-based prevention, treatment, and recovery of opioid use disorder. To request technical assistance, visit opioidresponsenetwork.org.